Hi, this is Dr. Kronowitz, and welcome to this segment in What's Hot in Plastic Surgery. In this segment, I would like to discuss stem cells. Stem cells is a term that's often used now within the field of plastic surgery. And what are we talking about? We liposuction fat from other regions of the body, typically from somewhere on the torso area. We filter that to get rid of all the oils, and we're left with several components. One is fat cells themselves. One are stem cells. Now, stem cells are cells that come from our bone marrow that have the ability to turn into various tissues. In this particular case, we want them to turn into new, fresh fat cells. In addition, we transfer tissue called vascularized stroma, which when re-injected along with the other components leads to new blood vessel formation. So the goal is to lead to new blood vessel formation and new fat cell formation, which can lead not only to increase in volume wherever we inject fat graft or stem cells, but also in order to rejuvenate the area. There are three particular areas that it's used very commonly. I use fat grafting extensively in my practice and have for many, many years. I like its use within the face. Within the face, it has a very good effect and has a very good rejuvenating effect on the skin, which instead of trying to peel off layers of the skin using lasers and using chemical peels, it works from underneath by increasing blood vessel, new fat cell formation with a rejuvenating appearance. In addition, it's very good in the mid-face, which is a very important area and very important to many patients in order to get fullness in the mid-face, which leads to the rejuvenated appearance. Part of facial rejuvenation is to be able to fill the upper face, and that's what youth is all about. And what happens as you age, gravity, like with the breast, tends to pull everything down. So one of the main goals of facial rejuvenation is to restore volume to the face, which is what I use for fat grafting within my mid-face patients. Within the breast, I've used it extensively for years. In almost every patient, I do any kind of breast reconstruction, or whether I do breast augmentation or even breast lifts. It works very effectively, again, to rejuvenate the skin in the case of mastectomy or lumpectomy reconstruction, where there can be scar that's formed from the mastectomy, and in many cases for radiation. In patients for augmentation, I use it exclusively to augment patients to get a larger size, as opposed to implants. Some patients want implants. I use implants. I use implants and fat grafting, or I use a fat graft only, which are harvested from other areas of the body using liposuction. Actually, I will be publishing the most significant series looking at the safety of injecting fat graft into the breast in regards to breast cancer. This will be published within the next couple months within the Journal of Plastic and Reconstructive Surgery. The other area I'd like to talk about is within the buttock. The buttock has become very popular in order to enhance and augment. Many women now like that appearance, and I usually will accomplish this using fat graft. I do liposuction from other areas and can rejuvenate and lead to a fuller buttock appearance. It works excellent in that regard as well. So in general, just to rephrase, stem cells, the so-called term that we hear a lot about, we obtain them by doing liposuction usually from the trunk areas of the body. We filter out the oils, which leaves us with stem cells, which are stem cells from the bone marrow that can turn into new fat cells, as well as vascularized stroma, which is little pieces of blood vessels that turn into new blood vessels. And then we actually transfer some actual fat cells, some that survive and some don't. But the actual effect that we want is the creation of new blood vessels and new fat cell formation into the area that we injected. The absolute fantastic thing about it is it's a minimally invasive procedure, really just requires small wounds in order to harvest the fat, and then just needle punctures in order to inject it, whether we inject it into the face, the breast, or the buttock. Well, that's the end for this segment of What's Hot in Plastic Surgery. I hope you enjoyed, and please tune in to the next segment. Thank you.